Hi, I'm Dr. Jigjinni. I'm the senior-most plastic surgeon in Ruby Hall Clinic and also in Indrayani Hospital in Nalandi. Today I would like to talk about myths and facts about plastic surgery. One of the biggest myths about plastic surgery is about what material people use to do plastic surgery and why it is called plastic surgery. People always think that it is something to do with plastic that is being used. It is not so. The plastic surgery word derived from Roman word plasti, which means repair. So we are very good at repairing tissues and making good the problem which is caused by either by cancer or by injury or by various reasons, and that is the reason we are called plastic surgeons. Having said that, we also use some implant material which is not exactly plastic, but it mostly is silicone. So it is used in different areas, like to augment the breast, to restore the shape of the nose, improve the prominence of the cheeks, and in various places. So one may say that we do use some implant material, but that's not exactly plastic. The next myth about plastic surgery is that we do scarless surgery. The nature is that any cut in the tissue always heals with a scar, and in obvious areas you cannot hide that scar. Many times when we do surgery on some areas, it is possible to hide the scar. So people think that we do surgery without scar. Suppose I have to do surgery on the chin, then what I do is that I cut inside the lip so that the scar is inside the mouth, so that's not easily seen, and that's the reason you see a scarless chin. And the same goes with the nose also. When I have to do rhinoplasty or nose shaping, what I do is that I cut inside the nose and do the reshaping of the nose, and here we go, then we don't have any scar on the nose, and that's why people think that we do scarless surgery. But these are rare occasions when we can hide these scars, but most of the time these scars are obvious. But again, we have fewer, finer techniques and better tissue handling, so that the scars that we produce are of better quality. And we also have understanding of the skin creases and skin tension lines, so we can put the scars parallel to the skin tension lines so that the scars are not obvious. This especially goes if we have to do surgery on the face, then we can put this scar in the smile lines or in the crow feet so that the scars are not obviously seen once they heal well. But this is a kind of a happy scenario, but there are times where the scars even produced by this plastic surgeon can have undesirable appearance. There are certain areas in the body which are prone to have bad scars, like the front of the chest, shoulder, and the back. And here if the person has a tendency to form keloid scars, even after the plastic surgeon has done the closure and given a fine stitching, a person can have a keloid or very bad looking scar. There are ways to treat those scars also, but this is the fact that there are certain innate tendencies or what constitution of the person which can sometimes dictate what type of scars one may have. The third myth people have is about the tissues that can be used for repair. Many times I see patients for hair transplant, and I am actively involved in doing hair transplant surgery, and sometimes I find that there are young men who come who have what I would say unusual balding for the young age, and many times the patient's mom or dad may offer to donate the hair for that boy, but this is not true. Yeah. It is not easy to transfer tissue from one person to another just like that. even in kidney transplant, you have to check, the blood type, and some tissue typing has to be done before one can make sure that the kidney can be donated from one person to another and it would be accepted. And when it comes to, tissues like skin and hair, the tissue typing is more complex and it's not easy to transfer or transplant tissue from one person to another. Another myth that goes around is that the plastic surgeon can totally change a person. This is probably due to, you find that a person in a movie or in a drama, is the character changes, and people think that this has been possible because of plastic surgery, and that's how it is portrayed in the drama or the movie also. It is not so. It is possible to change the appearance of a person, but not so dramatically that the person looks totally different or it's unrecognizable. The whole the aim of plastic surgery is to repair the tissues which are not functioning, so that the person with a problem with the function can be able to use that part. This especially goes with the hand trauma, or if you have a baby born with a cleft lip or palate, the baby which cannot breastfeed, or the baby cannot speak properly. So these are all places where the plastic surgery is done to restore the function. And also we sometimes repair the tissues where it is important for the survival of the patients. Suppose there is a person who has undergone complex surgery of the face or the skull, then we do repairs so that it is safer for the patient to recover from these kind of surgeries and lead a normal life. And perhaps what normally people think plastic surgery is, which is cosmetic surgery, where the person is born with normal appearance and wants to enhance that appearance, wants to look better. And that is the third aspect where we actually do surgery, so that the patient's psychological well-being is achieved by cosmetic surgery.